It is just a huge honor for me today to be podcast interviewing Eva Grayzel, who is a nationally recognized motivational storyteller with 25 years of experience in the spotlight. Eva's expertise in interactive storytelling techniques is incomparable. Excluding the kind of onstage charisma that cannot be taught, she delivers a proven method to educate and inspire audiences. A late-stage oral cancer diagnosis threatened to hijack her ability to talk the talk. After regaining her vocal cords, she crafted a thought-provoking story of survival, taking what could have been a tragic end and turning into a powerful new beginning. Eva conveys the realities of her journey, emphasizing relatable and meaningful life lessons. The power of her personal story is the motivation behind creating a model to teach story development for building businesses. Talk for Hope Family Book Series is a 2-book series empowering children with coping skills and communication strategies when someone close to them has cancer. Her Story Legacy is a 12-page guide for documenting personal stories, an invaluable resource for future generations. 6-step screening is an oral cancer awareness campaign. Eva had been given a 15% chance of survival, which fueled her passion to prevent what happened to be coming to others. My gosh, Eva, thanks for coming on the show.
Thank you.
I noticed you moved from Pennsylvania to Florida as soon as the Pittsburgh Steelers quarterback couldn't win the last 4 games of the season. Was he the sole reason you left?
Exactly.
Do you think he'll be back next year?
No.
Oh my gosh, but that's kind of like what cancer is. I mean, after the first 10 games of the NFL season, the Steelers are the only ones 10-0. They've obviously already won the Super Bowl, and now they're not even, they're not even in it. And my gosh, it's so bizarre when you have a family member where on Sunday everybody's having a ball and at the house, and then the next day someone has a migraine. They go to the ER and they have brain cancer, and you're like, gosh.
Howard, I always like to say that I don't have cancer. My body does, and that cancer doesn't define me.
So tell them your story. Yeah.
So in short, I had a sore on the left side of my tongue. It was an unusual place for what seemed like a canker sore. And after about 8 weeks, I went to an oral surgeon. He examined it. I complained of the pain. He said, if it bothers you so much, we could take it off. And I said, great, just take it off. 2 days later, I was fine. 2 weeks later, I get a phone call from his receptionist. She told me my biopsy was negative. I said, excuse me, are you calling the right patient? And she said, did you have tissue removed from your tongue 2 weeks ago? And I said, yeah, but I didn't know they were biopsying. And I really thought to myself, what on earth could they be looking for in a biopsy of the tongue? And she said, you have nothing to worry about. And I said, great. I didn't know I needed to worry. Howard, nobody ever used the words oral cancer. I never knew you could get it in the mouth. And I really believe if I had been educated, I would have never gotten to stage 4. So my story is that it was biopsied. I didn't know, it was hyperkeratosis, which is, the doctor said it was like a callus on my tongue, and 2 years go by and I have no obvious symptoms. The tissue and the color was changing, but I didn't feel anything. And then when the sore returned right over the biopsy site, there was 9 months of treating me for trauma. And when I was finally diagnosed, it was stage 4. I should have never gone that long. I've never smoked. I rarely drink. So nobody questioned the biopsy. Nobody asked, questioned it. And, I learned that there are 3 really good reasons why a biopsy should be questioned if a patient continues to complain. They could take the wrong tissue, they can mishandle the tissue, and they can misread it. And mine was misread.
Wow.
It is hyperkeratosis. When I was finally diagnosed in New York City, they asked to see that original specimen, and the head and neck pathologist said, yeah, sorry to tell you this, you should have been diagnosed 2.5 years ago with moderate dysplasia, which means you would have been recommended for consistent follow-ups and observation of that area.
Well, first of all, I want to congratulate you for being the most visible person for oral cancer. I've never, well, it's so bizarre when you're a dentist because when they started the American Dental Association, the first president of the American Dental Association was an MD, DDS. And was a medical doctor, dentist. And now today, the president of the ADA is also an MD, DDS. And I've been a dentist. I feel like I'm the bastard stepchild of medicine because I look at the same technology for diagnosing oral cancers, like the toluidine blue, for downstairs on women. It's paid for by all the insurance. They do the screenings. They do everything. And then you take the exact same protocol made by the same company for girls downstairs and move it upstairs. And then they're like, well, we're not insurance. Well, we're not paying for that. We're not doing that. Dentists aren't into that. And my team dentists, they haven't moved the needle on the 5-year survival rate of oral cancer since I've been here. And a lot of it is the money. The insurance companies will pay for you if you're a girl and it's downstairs, but a girl in her mouth upstairs, oral cancer screening. I mean,
Howard, do you know that when I lost teeth due to radiation, and I went to insurance and I asked for teeth so I could eat, so I could live, they said to me, your teeth are cosmetic. And I'm so sorry I didn't say to them, do you replace breasts after breast cancer? They do. Isn't that cosmetic? I would not call my teeth cosmetic when I need it to chew and sustain myself. Would you agree?
oh, and talk about losing all faith in reality. We have a veterans homeless clinic here, and they're all in there. They've lost teeth from shrapnel, and they have neurological disorders. And guess what? The veterans health insurance doesn't cover mental or dental. And it's like, are you out of your mind? I mean, they're not being plagued with other things. I mean,
So how come these MD DDSs aren't getting married and changing the face of insurance and dentistry?
Yeah, it's so bizarre how dentistry it's complete. They act like it's part of your dog or your cat. You're out there walking your dog, and you could have left it at home. But like dermatology, if you go to school and become a dermatologist and pop a pimple, you're a doctor. It's covered by insurance, and you get a television show. Just move that over to the mouth and try to place a pterygoid implant, and now you're not a doctor. It's not covered by medical. It's a bizarre world.
What's so ironic is that the health of the mouth is the window to the health of the whole body, this oral systemic health, and yet nobody's caught on.
Yeah, so keep going your journey. How did you get oral cancer? End up with a 6-step screening best practice in oral healthcare program. I mean that's a.
Well,
I mean, lots of people get oral cancer, but not all of them end up writing a book on it.
Well, basically, when I recovered and I got a second chance at life, I realized that there's just not enough information out there. If I didn't know what it was, I'm sure a lot of other people don't know what it was. So I started 6-step screening, 6 steps to a thorough oral cancer screening, and basically educating people about what a screening is and what dental professionals look for in a screening. I mean, I challenge you, Howard, to go ask your friends. Well, maybe not your friends, but the average people around. Do you get an oral cancer screening? Most people say, I don't know. What is it? And then they might get it or they might not. But I appeal to dentists to say, if you are providing a service, educate your patients about the service you provide.
Yeah, and they'll even look you in the face. They'll just say, they don't like anything related to cells. You got to call it education if it's anything. Oh, by the way, it's also confusing around the world because we call it oral cancer, and Europe calls it mouth cancer. And when I asked, when I was at the Royal College years ago, and I said, why do you call it mouth cancer? And they go, have you ever Googled oral anything? Dentistry is the last thing that comes up when so they call it mouth cancer. We call it oral cancer. And it's confusing because I'm in Arizona. Half the dentists are a DDS and half are DMD, and they look at the MDs and the DOs and the allopaths, and it's so confusing. Dentistry needs to get on the ball. I don't care if it's called DDS, DMD, who gives a DD. Just make it simple. But oral cancer and mouth cancer have to get married somehow, because it's confusing to the patient. But which do you prefer, oral cancer or mouth cancer?
Well, I'm just used to oral cancer, but I use both. But I think what's really important for the public to understand now is the difference between oral cavity cancer and oral pharynx cancer. With this whole rise of HPV and this whole epidemic, I think distinguishing the two are important because they're treated differently. It's a different etiology, different outcomes, different populations, and different symptoms. So, for example, I've met a lot of people who have had base of tongue cancer. Now, some people call it throat cancer. There's another one for you, but base of tongue cancer. And they don't know, they're not educated that a hard fixed lump in the neck could be an issue. So I have a friend who had a hard fixed lump. He's a big golfer. And what did he do? He went to his chiropractor and they figured it was muscular. And after several treatments, that hard fixed lump in his neck didn't go away. So the chiropractor referred him to a dentist who referred him to an oral surgeon. Finally, he gets referred to an ENT who actually scopes him. So there was a great delay. The idea is that when oral cancer is caught early, it's very survivable. But most of the time, it's caught late. That's a problem.
Yeah. By the way, I every time I think of your name, I still think of your rap song, "Oral Cancer Save a Life" rap.
Doesn't go away. It could be oral cancer. Catch it early. Don't delay. Hoarse voice, lump in neck, persistent cough. It could be oral cancer. Don't shrug it off.
You missed your calling as a rapper. You're a rapper, and I loved your book.
It's called MC Plays Hide and Seek. It's an award-winning book. It just won the Mom's Choice Award. And it's really unique because anybody who's going through cancer or has cancer, if they have children in their life who love them, this book helps to promote dialogue and therefore minimize fear.
So MC Plays Hide and Seek, Mom's Choice Golden Award winner and reader's favorite 5-star rating. MC is a cancer cell who shares just enough information about the nature of the disease to promote dialogue and minimize fear. The scary part of cancer is the unknown. Learn about doctors who look for cancer, understand feelings children express, and learn ways to cope. Empower children with knowledge and how to make a difference. MC Plays Hide and Seek, strengthens communication, building emotions. I remember in dental school, we were next to a children's center, and I noticed they put the oncology on the top floor, and the director said, we do that because it's pretty depressing traversing that. We want to keep it all up there. And I remember going up there when we were doing our rotations, and you could not go to the bathroom and cry. I mean, it was so unbelievable. How do you get used? I just don't understand how the workers can do it. I mean, when little kids are telling you things like, I just want to go to sleep and never wake up. And oh my God. How do you, what advice do you give them?
Because there's always something to look forward to. There's always something to give you joy. And that joy could be very different between two different people. For one person, hope might be one day without pain, whereas for another person, it might be living 6 months to see their kid get married. So hope is different to a lot of people, but there's always something to hope for, always. Whether it's just one hug or getting through one book, there's something that gives you joy. And I really believe that life is naturally in balance. And yeah, there's a lot of crap that you have to deal with cancer, but through it, you also see all this beauty in life. You see your friends come forward. You see love, you see learning and strength and courage, and you see all this stuff. And all that is really inspiring. It helps inspire people to get through their own challenges. So really, I believe that you can leave a legacy, that challenges are an opportunity to leave a legacy. of choosing courage and gratitude and moments to cherish with people you love.
So, Eva, where does all this come from? I mean, you almost sound like a Berkeley hippie from the 70s, love and hugs and all this stuff. Where does that come from in you?
It's just who I am. I mean, when you go through what I've been through, Howard, what you realize is that the most important thing in your life are the people in your life. So I became really sensitive to saying nice things to people instead of criticizing, which is really, it's so easy to criticize and it's not as easy to praise, to really say nice things and be curious about other people. So that's what I try to do.
There's about a 6-page thread on Dental Town on suicide, and I was when I podcasted the president of the ADA. When I asked him what surprised him the most, he said it was a hard pivot from COVID to suicide. He said it was a plague. I mean, it was a big problem, and it seemed to me that most of the time suicides were multifactorial. They'd lost a lover, substance abuse, or economics. It was a perfect storm. But during COVID-19, it just seemed like people were just checking out. It's like you couldn't find anything on their tab that was throwing you off. And then here's Eva. She's ready to just rap and dance. And
Hey, listen, Howard, I'm really comfortable talking about death. I was there. I planned my funeral. I really didn't think I would survive treatments for oral cancer. It's a very barbaric treatment. And I don't know that all dentists know what it's really like, but they put this mask on your face and it's so tight that my skin popped out through the mesh holes. It was sort of like a tennis racket shaped to my face. And it was bolted down to the table in 6 spots. Literally, it was like this on my face. And I resisted the urge to gag, practicing deep breathing, meditation, anything to get me through the treatments the first time so they wouldn't have to unbolt me and sit me up and then bolt me back down again. It's barbaric, aside from the fact that with radiation, every day you get worse. And you think you can't get worse, and you get worse. I mean, the worst of it for me was my epiglottis stopped functioning and loose saliva at the back of my throat would drip into my trachea, triggering these severe coughing fits, causing the blisters, the radiation blisters in my mouth to open and bleed. I mean, I didn't think I would survive. And literally one night, I reached that deep, dark place where I made a decision. I gave treatments my best and I wasn't going to go on. And that night, I wrote a letter to my children about my dreams and wishes for them, my pride and joy in them, my values that I hope to live on. And I wrote a note to my husband about where I wanted to be buried and what I wanted written on my tombstone, because I felt it was something he shouldn't have to decide. And we never talked about it. So I'm really comfortable talking about death. And when anybody's close to death or dealing with the death in the family, call me.
yeah, it is. It's got to be a scary subject, right?
It is. But everybody dies. And
Yeah.
I learned that it's really not about the length of your life. It's about the breadth of it and the difference you make.
Yeah. So where do you see oral cancer going in the future? I mean, are we doing a better job? Do you think screenings will increase? Do you still
I think it's getting a little bit better. It's very slow, Howard, in dentistry. I mean, I want to challenge your audience. How do they educate patients about oral cancer? Because if your audience isn't educating patients about oral cancer, then who is? So how are they doing it? Do you have posters on the walls? Do you have brochures in your office? How are you doing it? Do you send out tweets or texts, or how are you educating patients? So one of the things that I did for 6-step screening is I made 3 different postcards. So this one is a mailer, and you mail it out. And basically, it educates about the signs and symptoms of the disease. And it says that your next oral health appointment is in how long. There's also a self-exam card. something people can just pick up or you can put in the goodie bag. And there's one other card. This goodie bag card actually allows you to put in the patient's name and the date of their next appointment. And the beauty about these cards, which also show the 6 steps to a thorough screening, the beauty of the card is that patients may actually pass it on to somebody else and say, hey, do you get this kind of screening? And the dentist's name is on it, and hopefully they get referrals. So with Oral Cancer Awareness Month coming up in April, maybe you've got some listeners who are going to go out to 6-step screening and buy some of these posters, display them around your office and in any healthcare facility, and play a part in raising awareness and saving lives.
Another thing about the oral cancer, there's a there's a very famous football player. I'm sure you know who I'm talking about, who had this oral
Jim
cancer.
Kelly.
Yeah, Jim Kelly, but he really doesn't want to talk about it. Would you agree?
Jim Kelly?
Yeah, with the Bills.
Yeah, he talks about it. I think he talks a lot about his faith in his son who he lost, and he doesn't talk maybe as much about oral cancer, but he's out there.
Well, the point I was going for, I'm trying to say that as delicately as possible. Who's the other man who just came out and said, yeah, this is oral cancer from fellatio with women?
Michael Douglas?
Michael Douglas.
Okay, there's also Val Kilmer, the guy who played Batman.
Oh, Tombstone, man. We're in Arizona. Tombstone's, but
Right.
the stigma that that this HPV that you could have got while sexual or kissing or whatever. I think it's put a big stigma on this disease. It's almost like it's one thing if you say I have a urinary tract infection, but someone else like, well, was it an STD? I mean, the difference between a UTI and an STD is huge. And now oral cancer's got 2 kinds. One's from you were bad. You were smoking cigarettes. You deserve oral cancer. The other one's like, oh my God, you were bad too. You were kissing and all that. So it gets complicated with humans.
I've actually learned some interesting facts about HPV recently. Number one, it is not transferable on inanimate objects. So you can't transfer HPV by sharing a drink with a friend. That's one thing I learned. And the other thing is that couples, if one person is diagnosed with HPV or oropharyngeal cancer, their partner probably has the HPV strain, but their immune system is able to fight it. And there's no way to know when you got it. You could have gotten it when you were 18 years old. So it doesn't mean that you are unfaithful or anything like that. It can lay dormant for many, many years.
But here's the one thing I got to ask my homies and then be very, very honest with them. I mean, number one, this is our cancer. We're dentists. This is our territory, and dentists don't even give the Gardasil vaccine for HPV. I mean, a nurse can at a hospital. When dentists say to me, "Well, we're really not doctors," I'm like, "Well, you don't act like one. You don't even get rights to give the Gardasil vaccine." I mean, how many people have died from oral cancer and that could have been vaccinated that went to the dentist every 6 months, and the dentist doesn't even want to bring it up. He'll talk about bleaching, bonding, veneers, but it's like, dude, this kid's 12. They could die from Farrah Fawcett. Remember Farrah Fawcett? She died from anal cancer from HPV. She only had a 1% chance, but I mean, it's hard to believe that girl that was on a poster in my wall until my mother took it down. She found I was down in the basement. Well, I had it great. When you opened the door, when she came in, it was behind the door. So you couldn't see Farrah until you left the room and shut the door. But my mom eventually found it. I still think my sister Jean Marie told her. But anyway, the bottom line is, why are these kids being seen every 6 months and you're asking me if they have dental decay, but you're not asking if they have the Gardasil vaccine, and you're not even legal to give it? Same thing with the flu. How many grandmas come in for a cleaning and they don't come back in 6 months because they were one of the 10, 20, 30,000 died of the flu, and the dentist and the hygienist with a 4-year degree didn't even offer a flu shot?
I think that people don't realize that this vaccination, this is about life and death. It's like the COVID vaccine. It's life and death. This isn't. So if there's a vaccine that can prevent you from dying or getting cancer, there's a vaccine that could prevent you from getting cancer. Why wouldn't you do it? And I think that dentistry is afraid of talking about sex. They feel like that's not their department. They were not trained to talk about sex with their patients. And I'd like to suggest that you don't need to talk about sex. You just need to say there is a vaccine to protect your child from cancer. Isn't it worth it?
Yeah, they don't like to talk. They don't like to sell, and they don't like to talk sex. Selling and sex. Maybe it was a bad experience where they paid money for sex. Do you think that's where it comes from? And they paid for sex, and then they never did it again. But I don't understand it. It's like Tennessee, though. Got a shout out to Tennessee. Tennessee was the first state, and still the only state, where they went to their state board and they said, "Why can't a hygienist and a dentist give a flu shot?" And in Tennessee, they said, well, "We don't know." And they just raise their hand and ask. And this is what dentists, this is what the next generation needs to do. They need to let their state boards know that we're going to give a flu shot. We're going to give an HPV vaccine. And if the local dental board doesn't agree, well, that's their problem, not ours. You just can't keep going along with it.
Challenges every day.
Yeah, but you're right. Whenever it touches sexes, I remember when the governor of Texas was so sold on this HPV vaccine, he said he was going to mandate it for all. Remember that, all high school children?
Right. Yes.
Oh my gosh, that state almost turned upside down. It's like. Sometimes it seems like
they're in Australia. They've actually vaccinated all girls since the age of 12, and then they started vaccinating the boys. It's a national program, and they have noticed a great decline in cervical abnormalities, and I'll bet they'll see a major decline in oropharyngeal cancer.
Oh, they absolutely will. It's just I guess here's another thing I'd say to the young kids is when I was in high school or college, I thought everything would be done in a year. This take another year. But as I'm coming up on 59 this year, you realize that, man, everything just takes so much longer than you thought it would. Like you think when the HPV vaccine you'd be so lucky it was invented, it came out, that the whole country would vaccinate, within a year. And here it is a decade later, and we're still trying to.
Only I think it's only 42% of boys and 60% of girls are doing it.
Yeah, huh?
But it used to be a series of 3 vaccines. That was tough. Now it's only 2.
The other problem in oral cancer is, dentists do cleaning exams, fillings, crowns every single day, but they might only be able to count an oral cancer patient in their memory, every few years. So how do you keep something at the front of your mind that is not so common as what,
Right.
We mostly see cavities and toothaches and broken teeth.
Yeah, except none of that's going to kill you. Oral cancer can kill you. So there's the difference right there. And I know dentists don't have the training in dealing with cancer. It's not typically what they've learned how to do in school, and they want to sort of avoid it, especially older dentists. But my feeling is that every dental checkup, the medical history should include questions like, have you had any one-sided pain or persistent sore in your mouth? These are difficulty swallowing. These are questions that have to be asked now.
So, people listening to you right now, most people on the podcast, they're driving to work, they're on the Stairmaster. You got 2 websites, Eva Grayzel .com, and the other one is 6, spelled out, SIX, stepscreening.org. Which one should they go to?
Either. There's information on both, but as a professional speaker, I use evagrayzel.com, and 6-Step Screening is my advocacy work. So it's raising awareness about oral cancer. And on that site, you can also find information about me speaking. There are also videos on there that you could show your team for a team meeting sometime at work, and then practice on each other. Because, Howard, I'd like to know how many dental professionals listening to this show actually get screened for themselves. You know, it's one thing to screen your patients, but if you don't feel it's important to screen yourself, you're not going to feel it's as important to screen your patients and probably do a half-assed job.
Now is the now what are your thoughts on the hygienist doing the oral cancer screening or the dentist?
Well, certainly the hygienist could do a screening. Absolutely. They're on the front line of the disease, and patients tend to talk more to the hygienist because they have more time with the hygienist. But the dentist should double check, you know, take a quick look as well. I mean, it's not so difficult to yank out that tongue, look at the back lateral borders, feel and look around. I mean, you're looking for all kinds of things, not just oral cancer, right?
Yeah, I love your on your website, sixstepscreening.org. And she's got posters that you can get for your office. Oral cancer kills 1 American every hour of every day. Oral health means more than clean teeth. Do you have any of these symptoms? Persistent mouth sore, pain in mouth or ear, chronic hoarseness, unusual sore throat, abnormal swallowing, non-tender lump neck. Every stage oral cancer is often painless and goes unaffected. 6 screening step: tongue, cheeks, lips, floor, palate, throat, neck. And you have these posters. They look, they'd be fantastic and informative.
Thanks. So with Oral Cancer Awareness Month coming up, how about, Howard, let's get everybody on board. And I think if we all work together, we could raise awareness and literally save lives. So buy your posters, your postcards, do something.
Yeah. I was very shocked they got this vaccine in 9 months. Because when I got my first flu shot in dental school, they said, remember, this is just for influenza. It's not for the common cold, which is 90% time rhinovirus, 10% coronavirus. And I said, well, why don't they make it for that too? And they go, oh, they will. It'll be like next year. And then 40 years later, they still hadn't had it. And now they have it. And now the teams at Moderna and Pfizer say the next target they're going after is HIV. And but we're really at a world-changing time now, because with these new technologies, they're going to be targeting things very differently. If you had oral cancer, who do you think's leading the R&D? Where do you think the Albert Einsteins and Galileos and Newtons of oral cancer are these days?
Well, my go-to is the Oral Cancer Foundation. I think the information is the most accurate on that site. And also they support research. So if you want to give a little money, that would be a great place to give your money and support research and advocacy and education.
And so that would be your recommended to go?
Yeah. But you know, Howard, it's like everybody all over the world has pockets of places where they're doing research on HPV and oral cavity cancer. And somehow, if they could all work together, we could get stuff done so much faster. But, you know, there's competition and money to be made. So prevents us from working together.
The other thing that's really neat is when it seemed like when I was in dental school, it seems like all the research came from the same 5 countries. Were just basically carrying the weight of pretty much all the research. And nowadays, it's so nice to see every single country you can think of is a heavyweight in research. I mean, it was hard to see that coming. And I mean, groundbreaking research, and it's like some little university in a discrete country. I mean, it's just it's truly exciting times. So what else advice you give to dentists on oral cancer?
Well, I just feel like it's important to develop a standard of care in your practice so that a dentist knows about the quality of screening that each and every one of the hygienists performs. And because I hear often, I do an oral cancer screening, but that hygienist doesn't. So when patients go between hygienists and they notice a big difference, it's a problem. And the other thing is I really feel it's important that the dental assistant and anybody else in the room plays a part. A dental assistant sitting on the other side of the chair has a different angle of the mouth, may be able to see something else. So it's important to really value the job that every person does in the dental practice, and that really includes the receptionist. When I moved to Florida, the first thing I did was start making phone calls about finding a new dentist. And Howard, can you guess what the first question was that I asked? I said, "Do you provide an oral cancer screening?" First question I asked. Now, most receptionists said, "Hold on a second, I'm not sure. Let me get back to you." And I'm like, forget it. So if the reception isn't on board with the quality of care that a dental practice is providing, you're losing out.
Yeah. So, Brian Hill, over at the
Oral Cancer
the
Foundation.
Oral Cancer Foundation, he was a stage 4B oral cancer survivor, and he had successful treatments at MD Anderson in Houston, which is just MD Anderson, Mayo Clinic, Scripps, Sloan, Frederick Keating. There are just some amazing hospitals. But how is his story different than yours?
We were diagnosed not too far away from each other, less than a year. He was in the dental business. He sold implants. So he knew a lot about dentistry and also about the science behind dentistry. So he was the perfect candidate to really motivate a change in the world of oral cancer. He founded the organization and he's dedicated his life to it. So that's pretty admirable.
Yeah, that is really, really cool. And he's been doing it for a long time.
Very long time. And one of the things he loves about what I do, which is he's very scientific and I am not. I mostly tell my story when I'm on stages, when I speak at Hinman, Yankee, wherever. And basically, what I do is I don't tell dentists what to do. It's not my place. But by telling my very personal and intimate story, they feel deep in their gut that they could be doing a better job. It motivates real change because they look at me and they say, that could be my patient. What am I doing so that my patient doesn't have that story to tell?
Wow, I never knew that he worked for a dental implant company. I missed that completely. Do you remember what company it was?
He may have owned it.
He owned the company. Wow. Wow. So, my gosh, I can't believe how fast the time has gone. But was there anything else you wanted to address with the people about oral cancer?
Not particularly, except that I always say screening is just as important as cleaning. And most of the general public think that going to the dentist is about clean teeth. They don't realize that going to the dentist is about oral health. So my friends who buy a new truck for $150,000, they go for every service. They wash their truck upside down and backwards and detail it. So I'd like to know, what is it that car companies do right that dentistry is doing wrong? Why isn't everybody who has a dental plan with the work from work, why aren't they using it? Why aren't people going to the dentist regularly? And I believe that dentistry could do a better job educating patients about the value of services they provide. And it's not just about clean, pretty teeth. It's about oral health. And the health of your body, the health of your mouth is the window to the health of your whole body. And if we start, if patients are educated about more of the systemic health, I really believe more patients will be going to the dentist more regularly. And as a result, we'll also be catching oral cancers earlier.
And let's just leave on the Michael Douglas again. I mean, Michael Douglas, American actor and producer, primarily in movies, television, 4 Golden Globes, yada, 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 yada. And he was treated with radiation and chemotherapy. And with this now behind him, he has generously become an advocate for early discovery for the disease. But how do you think we can get more people to talk about HPV and oral cancer?
I think we need more celebrities like Michael Douglas to step forward. But the problem is that people who get this disease are often disfigured and they don't want to be in public and they're not understandable. So it's catch-22. It's hard.
And most people listening to the show don't know who Blythe Danner is, right?
They may.
They may.
But her husband died. That's right. Her husband, Gwen, they all know Gwyneth Paltrow, Blythe's daughter.
So Gwyneth Paltrow was Blythe's Gwyneth's mom, right?
Yes. And Gwyneth's father, Bruce Danner, died of oral cancer.
Wow.
The interesting thing, Howard, is that he was hoarse. And they couldn't figure out why he kept getting this unexplainable hoarseness. And even Michael Douglas, he went to the very best voice doctors in New York City. Nobody got it. They didn't, think ENT check for oropharyngeal cancer. So hopefully your listeners will know when they hear a voice that's consistently, persistently hoarse, that could be a sign and they should be referred to an ENT. And not any ENT, not the guy next door who might do inner ear infections and strep throat, but an ENT that really has experience with oropharyngeal cancer.
I cannot believe that Blythe Danner is Gwyneth Paltrow's mom. I don't know why you think that's so funny. It seems like when Gwyneth's in the news, the last thing she's in the news, she had some candle named after a female body part. Very, very artistic people in that family. But hey, thanks for all you do. Thanks for fighting this stigma. Thanks for keeping this on the front border. It's still been an injustice from the day I graduated in '87 to today. It's still not fair in any way, shape, or form. Like I say, girls go to their doctor. The exact technology is covered 100%. That same girl goes to my office, and the doctor won't talk about it. The insurance won't pay for it. It's still some stigma going on. And with all the media today, with social media, with podcasts, and all the ways to communicate, we need to communicate this stigma away and get back to work. And thanks for working so hard.
Thanks, Howard. Thanks for having me on the show.
All right. Have a great day.